Hi, this is our group project that we did on anthrax. My name is Christine Wilson.
I'm Roxanne Somers.
I'm Mireza.
And this is our presentation.
Introduction. Anthrax was discovered by Robert Koch in 1875, identifying the bacterium known as Bacillus aureus. It was discovered in Western, which is a part of Poland. It was discovered because of the widespread causes among the animals and humans in the United States, Germany, and Britain. The causes were well known because of the animals' products these countries produce and manufactured. Anthrax can be found in the soil and it is automatically affected animals. Anthrax can affect people who have come into contact with the infected animals. Moreover, it is considered to be the least contagious disease, and people cannot catch it from one another. It can cause extreme illness in human and animals that develop between 1 to 6 weeks after exposure. Causative agents. The causative agent of anthrax is the gram-positive non-mortal spore-forming bacterium. Its spores can persist in soil and water for years and can also be
Aerosolized.
A rapid, sensitive, and specific method is needed to detect this bacterium. It is very toxic and considered to be the most deadly. It can survive in soil for decades. The organism can live in a dormant form known as spores, which are difficult to destroy. The spores germinate at the site and then enter into the tissue and spread rapidly. Once the spores are inside the body and activate, they multiply rapidly.
The diseases mainly affects the gastrointestinal system and respiratory system. Symptoms develop within 6 days of exposure to the bacteria. The main symptoms are fever, chill, headache, cough, stomach pain, tiredness, dizziness, vomiting, and body aches. Vomiting of blood occasionally occurs after the bacterium invades the GI system, and then it spreads to the bloodstream. When the disease affects the respiratory system, the symptoms will be a sore throat, headache, shortness of breath. It normally affects the lungs and the chest, and signs of inhalation anthrax are not noticeable for months. If untreated, anthrax can cause several illnesses and even death. According to the CDC, it can also be contracted by breathing in spores, eating or drinking things contaminated with spores, or eating spores in an open wound. Anthrax is contracted depending on your line of work and things you may or may not have been exposed to, such as working with infected animals or animal products, like eating raw or uncooked meat from an infected animal. You can get infected with anthrax if spores get into your body. Spores are then activated and turn into anthrax bacteria. The bacteria can then multiply, spread throughout the body, and poison the body, causing severe illness. According to Mayo Clinic, some tests that can confirm if you could have been exposed or not are a skin test, which is a sample taken from a cut of your skin for signs of cutaneous anthrax. A blood test can be tested for anthrax bacteria, a chest x-ray, or a CT to check for inhalation of anthrax. Stool testing to see if it is in your digestive tract. Lastly, a spinal tap where fluid is taken to be tested only if the doctor suspects systematic anthrax due to possible meningitis.
Some medical treatments can be as simple as an antibiotic, which is Cipro, or doxycycline, or removal of infected tissue. According to the Mayo Clinic, researchers have developed antitoxin therapies, raxicubin and oblizaxibin, for inhalation anthrax. Instead of going after the bacteria that causes the disease, these medications help eliminate the toxins caused by the infection. Antibiotics are treated when it's caught. People with severe issues may be treated with fluids, ventilators, blood vessel tightening medication, or vasopressors to raise blood pressure. Anthrax is a rare disease known mostly in Africa and Central and Southern Asia. It occurs regularly in Southern Europe as well, and at least 2,000 cases occur a year, with 2 cases typically in the U.S. Population affected are everywhere, no matter the age, sex, or race of the person. Cases are rare, but they do exist higher in those areas. Essentially, anthrax is treated if found early. Some issues can be short-term memory loss and fatigue. If caught early, again, it can be treated where a full recovery is expected. NCBI says following recovery, conclusions of small to medium cutaneous lesions is done with minimal scarring. Larger lesions or lesions on mobile areas such as the eyelids, scarring and contractures can require surgery correction to return to normal, and large cutaneous defects may require skin grafting. It stated that between September of 1979 and June of 2018, there have been 122 people affected worldwide with the bacteria. It's resulted in 13 human deaths and 2,300 animal deaths between the time as well. 2018 was the latest exposure in a cattle farm in France. Many people have been hospitalized during that time, but the death rate is lower than that of the infected. There has been very little research done in the last few years about anthrax. 2 articles were recently published in 2020 about the management of anthrax and the current state of anthrax vaccines. Before 2020, no research had been published since 2002, which comes as no surprise because the first cases of anthrax being used as a weapon was in 2001. It stands to reason that most of the research and journal articles were from the early 2000s. The journal article about the current state of an anthrax vaccine was actually very interesting. It talked about how a pre-exposure shot has been available since the 1970s. Through clinical trials, the shot was determined to be effective and could be used in patients post-exposure of anthrax. In the next article, it talked about the management of anthrax. It specifically talked about the resiliency of anthrax in degradation in the environment because of the spores found in anthrax, which make it easy to disperse and very, very dangerous. In the article, it talked about how the characteristics of anthrax were the answer to how to manage it. There aren't any articles talking about the future research of anthrax, but I think we should start researching other ways anthrax could potentially be helpful to us, whether it be to treat other diseases and illnesses, or if the vaccine they created for anthrax could be used as treatment for other diseases and illnesses. We chose this topic because of how fascinating the evolution of anthrax is. Before it was weaponized in the 20th century, it was found naturally occurring in the soil. It only affected wild and domestic animals because of the vegetation they would eat. It became a weapon when in 2001, someone put powdered anthrax into letters and mailed them through the United States Postal Service. We all remember when this event occurred and the panic that followed. Nowadays, it's not uncommon to hear about anthrax being found on letters addressed for celebrities or government officials. We wanted to dive in and understand anthrax from a microbiology level. We also wanted to find out what features of anthrax cause it to be poisonous and in some cases deadly. So let's see if you guys were paying attention. I'll read one. In what year was anthrax first used as a weapon?
How is anthrax contracted?
A spinal tap procedure can be performed to test for anthrax. True or false?
Anthrax is a relatively rare disease, but some countries still report a high number of cases. Which countries have high reports of anthrax cases?
What components of anthrax makes it easy to disperse?
Let's see what you know.
So the correct answer for number 1 is C. The correct answer for number 2 is D. The correct answer for number 3 is A. The correct answer for number 4 is B. And the correct answer for number 5 is A. And these are our credits and our resources. And thank you so much for watching our video, for listening to our presentation.
Bye. Thank you.